I'd like to introduce our final keynote speaker, Dr. Martin Eichelberger, President and CEO of Triaj. Dr. Eichelberger is a renowned expert in the field of pediatric trauma care and injury control. He's a pediatric surgeon and founder of Emergency Trauma and Burn Services at Children's National, and founder of Save Kids Worldwide, a global network of organizations with a joint mission to prevent accidental childhood injury, a leading killer of children aged 14 and under. He also serves as a professor of surgery and pediatrics at the George Washington University School of Medicine. In 2018, he founded Triaj to improve the medical care of children worldwide through revolutionizing the diagnosis, treatment, and care of patients. Dr. Eichelberger.
Thank you very much. I appreciate the opportunity to participate with you this afternoon and share some ideas about Triaj. In 2011, I received a phone call from Kandahar, Afghanistan, from Eric Elster, who was the commanding officer of their trauma system. And he said, Ike, I got a real problem. He says, I've got a 6, 8, and a 10-year-old who stepped on a landmine and are in our combat hospital right now. And I've been able to stop the bleeding. They're hurt badly. But the reality is, I really don't know how to take care of them. Can you help me? Well, when he asked me, can you help me? It was an eye-opener, and it also started the whole process of trying to answer that question. The first thing we found out was the number 3 cause of death in the United States are medical errors, not even a disease. And so consequently, we were concerned about that, and we came to find out that the real disparities exist because of the fact that doctors and nurses and corpsmen lack access to just-in-time information or protocols that are evidence-based. And that becomes a real problem because of the fact that there's so much rapid change going on in medicine today that every year it doubles. Every 2 years, the information volume doubles in medicine. So it's very hard to keep up with what's going on a day-to-day basis and making sure that each of us know exactly what to do, when to do it. So our focus and objective was to maintain and improve quality of care, provide a safe environment for patients, and to have our teams collaborate in a much better way. Because if we did that, then we're going to reduce the cost of care on an ongoing basis. So the vision of Triaj was really to revolutionize the diagnosis, treatment, and care of patients through an advanced clinical decision support system, meaning we were going to help the doctors and nurses have the information that they needed, really with the best practices in patient treatment just in time. So it was available anywhere, anytime, worldwide. So in essence, then, what we're trying to do is to take the best medical knowledge and put it on a platform where we can communicate it to everybody that needs it at a given point. It's especially important for any patient that has an injury to actually be able to get on the right track. The value proposition of that is very clear. It's that we're going to save patients' lives. Next slide, please. To give you an idea of how complex it can be for you as a patient, if you look across here, you as a patient are going to go through resuscitation all the way through discharge. And in each one of these different phases of care, you can see that there's requirements for guidelines, resources, procedures, knowledge, transfer of information that makes a difference to the individual patient so that there's no mistake made in one area or another. The specialization in each one of these verticals is a very challenging problem for us. And so consequently, what we're trying to do is to create almost like a pit crew, if you're a NASCAR fan, where all these people jump out, do the right thing at the right time from different perspectives so that the patient ends up doing well. I think that if we could, you could understand that most of the time, doctors and nurses don't use checklists. What happens with you is that you go to get on an airplane and you better hope that pilot up front is using a checklist. So we were going to take that concept, which has a real impact on patients, and get it to where we can do it throughout the entire process. So if a kid who is 3 years old comes in with a femur fracture and weighs 12 kilos, we can auto-populate that care in this clinical decision-making system so that everybody's looking at the same information at the same time. help you understand that a little bit more, I'd like to show you a video that'll give you the idea of what the future looks like and how we can actually make a big impact on the care that you and your family will get. So you go ahead with the video, please.
What if communication made all the difference? And what if a split second could save a child's life? This is Triaj, a revolutionary mobile network designed to assist in the treatment of injured children. It's a pediatric patient database that allows you to create detailed and in-depth profiles that follow patients from injury to discharge. But Triaj is so much more. It's an advanced clinical decision support system that reduces uncertainty in the treatment of pediatric patients. By using real-time guidelines created from evidence-based best practices, Triaj suggests sequences of care and can help you track procedural steps along the way. Its simple functions and intuitive design integrate seamlessly and help you monitor progress during medical procedures, all through the Triaj network. It deliberately links the phases of medical care and can be customized with the help of our advisory board with decades of practical experience. Triaj will help you avoid medical errors while improving the quality of patient care, all from your mobile device. Communicate timely information while enhancing collaboration for the healthcare team, from first responders to nurses and physicians. Triaj. Save children's lives with just-in-time care.
So I hope that gives you a vision of what's possible to care for patients. And this can occur in many different places as outpatients, school systems, all of these types of things where medical professionals are going to be, information can be placed on that, whether it be injury or illness. Can you imagine if we link this to artificial intelligence? Well, we started thinking about that when we made a strategic plan that involved UReveal, which is a strategic AI partnership that we've created. The thing that's really fantastic about that is that each one of those points that you saw will create big data. This will reside up in the cloud so that we can download and evaluate that information with huge amounts of data. Instead of looking at one patient's femur fracture, we're looking at 1,000 femur fractures where we can actually anticipate what really should be done for these patients and how to improve their care. So the thing that really impresses me is that AI, by using machine learning, will allow us to increase the number of components of illness and injury into the system. The natural language processing will allow us, and you can see the surgeon sitting there, he could ask Siri, what antibiotic should I use for this particular patient? So the actual system itself will be talking back to you. And then at the same time, the neural networks that are available will allow us to evolve best practice as we go along in the activity of accumulating all this data. The advantage of this and the value proposition here is that we're going to increase the quality, improve the safety of the patient, and coordinate our teams in a much better way. Next slide. Why would a hospital like doing this? Why would they be interested in this? Well, there are a couple of reasons. One is that we can actually decrease the cost of care by 50%. The other thing that's very important is that the nursing care can be reduced by 40%, meaning that they don't have to go looking for the information. They can have it right by your bedside and spend more than 40% of their time taking care of you. The other part of this is the length of stay. We can save $1 million just by making sure that the patients are out of the hospital at the right time. Plus, when you look at the insurance companies that you cover, they will actually not allow us to take the information and get reimbursed, and we can project that it's going to be probably $65 million that this process and system will help out. So the value proposition there for the hospital is that there's going to be the highest quality of care in a safe environment at a lower cost. Next slide. The market opportunity is enormous. The total available market is around $19.4 billion. That involves 16,000 hospitals worldwide and 45 million providers. In our forecasts, we're looking at 140 hospitals, which is less than 1% of TAM, and 70,000 professionals that will have this downloaded onto their systems. And if we do that, the revenue for the end of 5 years will be $46.4 million. The return on investment is going to be significant because there's a high recurring subscription rate. That model allows us to have growth of revenue on an ongoing basis. And the other advantage of having a software project is that the total equity that we're going to need is $7 to $9 million before our EBITDA switches to a positive in 2022. Next, as you well know, the annual expenditures in healthcare today is $3.5 trillion. And the fastest area that's growing in healthcare is health tech. And the capital that's being raised by venture capitalists in 1 year is $12.9 billion. And the deal size for individual companies is $3.4 million in general. Next. So if you want to drill down a little bit more, the health tech sector is going to be in a position where it continues to grow every year. If you look at 5 years, and this data comes out of PitchBook, you look at 135 companies, they exited in an M&A with a total valuation of close to $23 billion, and the median exit valuation of a particular company was 175 million. Next. So we're interested in trying to make sure that we have enough investments and funding to make sure that this process really works. The friends and family, and we've already closed that at $1 million, and we've created a bridge between $500,000 and $1 million, and we've raised about $250,000 of that. The bridge vehicle that we're using is a convertible note with an 8% interest for investors and a 20% discount when we convert to the seed round. Our initial growth seed round, we're looking for $3.5 million to be able to expand our company and make more progress and get this in the hands of the right people at the right time. Next. So in closing then, we have created a powerful clinical decision support system that's flexible. It's a platform that actually allows us to communicate just-in-time information that's evidence-based. It's the best practice that's available. And when you link that to artificial intelligence, we're going to revolutionize the way diagnosis, treatment, and patient care is going to occur. That means that we can have information any place, anywhere, worldwide. Once the network's in place and we have the hospitals and physicians using this on an ongoing basis, we're going to see the increase in the quality of their care. The safety of the patients is going to be solid, and our team collaboration are going to be better because people are going to be using the same information, not disparate information. And finally, the costs are going to go down. For you as an investor, the ROI is really significant with the recurrent revenue and the subscription model that we're using. So Dr. Elster, yes, I can help you now. After 9 years, we've been able to come up with a system that's going to be available for you. The question I have for you as the audience is, can you help us? We're looking for first-class teammates that want to invest in this project that's going to have an impact on patients for a long period of time. The value proposition there is that if we can work together, we're going to save children's lives. Thank you so much for your time, and I really appreciate the privilege of your attention.
Thank you, Dr. Eichelberger. Really fascinating. We've been working on this work the last few days, and it's really been an experience getting to know you and your work much deeper. Just as a reminder for our audience, you may submit your questions through the question functionality on GoToWebinar. And this session, of course, is being recorded and will be accessible on Cavendish IQ, where you may also get in touch with Dr. Eichelberger and his team. We are happy to facilitate introductions afterwards. Get in touch with us. We'll help you on that. So, Dr. Eichelberger, you discussed a few broad metrics. Can you go into a little more detail on your go-to market strategy for this technology?
Yeah, the technology is going to roll out in two forms. One is the enterprise or the hospitals themselves, and we're focusing on hospital networks. To give you an example, HCA could almost 1,000 hospital systems that they're involved with. So what we are going to do is to build one hospital up with this Triaj system, and hopefully that's going to spread throughout the network. So we only need 143 hospitals, and we think we can accomplish that in the next 5 years. We have 2 pilot studies going on right now at Children's National Medical Center in Washington, and we have one at the Valley Children's Hospital in Fresno, California, and hopefully we'll have one in Chicago within the next 2 or 3 months. The second way we're going to do this is we're going to take this app, which is probably going to be launched this coming August, which is several months away from now. We're going to put that in the Apple Store and allow that to be downloaded to physicians and nurses worldwide. Corpsmen and the medics, they're all going to be interested in this technology because of the fact that they're going to have the same information that doctors and nurses do so that they can make the right decisions for the patients at the right time. So between the enterprise operation and our one-on-one professional operation, we think we're going to be quite successful in the way we're going to roll this out. We're in the process right now of doing a significant amount of digital marketing to lead up to the point where we're going to launch the Apple Store. Then after that, we would start to look at the Google Store also.
So that leads into another question from our audience. You're going to be launching this in multiple markets. How many users before what you see as a critical mass developing that truly makes the data influential?
I think it's going to be individual patients or healthcare providers. 70,000 is what we're targeting right now for the first 5 years. So in the first 5 years, if we can get in 70,000 and we can start up this operation and within 5 years, at least 140 hospitals, I think we're going to be a very credible operation. In the next, we're going to be evident positive in 2022. We think that's going to be a very impactful perspective for investors to see that we're making progress. But the most important thing is we're going to start saving patients right off the bat, because it's going to be easy to get information to people like Eric Elster all over the world. My hospital needs it. Every hospital I've been in needs it all over the world. So I think this is a simple solution to something that's going to make an impact and save children's lives. But at the same time, the runway that we're creating here is for adults also. So eventually, over the next 5 to 10 years, we're going to start putting diagnoses on there that affect adults. I mean, the information we're putting on now has an impact on adults. So it's generic enough that we think it's going to really expand over the next 10 to 15 years.
And sir, who in your opinion do you see as closest competitors or
I don't think right now there is a strong competitor doing what we're doing. There is a group, what's the name of that group? Just in Time. Just in Time is an app that will download all types of information onto your app. It's almost like having a textbook so that you're reading the information off of this app. The difference with what we showed you today was that we're showing you what the next steps are. And as you go to the next step, it will link in information that you need as a lecture or as actual surgical performance so that you can actually see the surgery performed before you go to the operating room. There's surgeons all over the world that have capacity to operate, but they don't know how to do it when it comes down to children and some of the more interesting things that kids bring out. So I think that we're going to have the opportunity to really roll this out in a significant way.
All right, this is quite a special project. So looking at our time, we do have to conclude the question and answer session. As I previously said, Dr. Eichelberger, his team, his work all available through Cavendish IQ, also able to connect with them through me, through my colleagues. Please do request an introduction through the survey going out after the end of today's broadcast. So with that, I want to thank you, Dr. Eichelberger, your team, for taking the time to come speak with us today. And this is something to keep an eye on as we go forward.
Thank you very much. I appreciate it.